Hello students, today we will discuss about the cavernous sinus. This cavernous sinus is also a dural venous sinus, and this sinus also present between the two layers of dura mater which is present in the cranial cavity. So what are the important things which you should know about the sinus? That the cavernous sinus are the two large venous plexus. That means it is a paired sinus. Clear? In the class of dural venous sinus, I told you that there are two types of the dural venous sinuses, unpaired and paired. So cavernous sinus is a paired sinus which are two in number, and they are actually the venous plexus that present on both the side of the body of sphenoid bone in middle cranial fossa. So these are the two questions here for your exam, that where will you find the cavernous sinus? Answer is in the middle cranial fossa, and more specifically where in the middle cranial fossa? Answer is on the side of body of sphenoid bone. Now the another important thing about the cavernous sinus, that as the name suggesting that it is cavernous. Cavernous means it is having multiple cave. Now what do you mean by cave? Small spaces. And cavernous word we are also using for the muscle is known as corpora cavernosa. Now the difference is that this cavernous sinus is actually not having the trabeculated venous spaces. Trabeculated venous spaces is a feature of corpora cavernosa, but this cavernous sinus is actually having the plexus of vein. Earlier it was thought that cavernous sinus is also having the trabeculated venous spaces. Now when you will see the appearance of this cavernous sinus, you can see that there are multiple small spaces, and these spaces are resembling the small caves, and that's why the word came here is cavernous sinus. Second thing is that you can see this is the sphenoid bone. This is the sphenoid bone, body of the sphenoid bone, and on both the side of the body of sphenoid bone you have the cavernous sinus in middle cranial fossa. Now what is the extension of this sinus? ये sinus कहाँ से कहाँ तक extend है बच्चों? So when you will see the extension of the cavernous sinus, it starts from the superior orbital fissure. From where? Superior orbital fissure near the apex of orbit, and then it will go posteriorly up to the apex of petrous part of the temporal bone. Okay? So that we'll discuss in the coming diagram. Second thing is that its ends are pointed. So when you will see the sinus, it is a spindle shaped sinus in lateral view. That means it is looking like an elongated sinus. Then its dimension, it is 2 cm long and 1 cm wide, which you can appreciate in this diagram that this is the elongated sinus, and these sinuses are present on both the side of the body of sphenoid bone. This is your middle cranial fossa. So you are able to appreciate that on the medial side of the middle cranial fossa you are able to see this sinus. Now second thing is that it is the anterior end, it is the posterior end. This anterior end is near the apex of orbit. Now this is the orbit, this point is known as apex, this is the base. Now near the apex, posteriorly you will have the superior orbital fissure. So the sinus anterior end is near the superior orbital fissure. The sinus is elongated in shape, and when you will see the posterior part, this is your petrous part of temporal bone. So this is the apex of petrous part of temporal bone. So when you will see the cavernous sinus, it is a paired sinus. The sinus present on both the side of the body of sphenoid. It is present in the middle cranial fossa. It is elongated, extend from the apex of your orbit near the superior orbital fissure, will go posteriorly till the apex of petrous part of temporal bone. Now in this diagram also you can see that this is your cavernous sinus and this is your body of sphenoid bone. Okay? Now what are the different wall of the sinuses? Now this is the something important concept when you are reading the sinus, that it lies in the space between the periosteum of the body of sphenoid and the inner layer of dura. So it is very commonly asked question that where we have the dural venous sinuses. So we know that dural venous sinuses always present because of the separation of two layers of the dura mater outside the brain. The inner layer is the meningeal layer, outer layer is the periosteum. So in the same way, this sinus is also present because of the splitting of these two layers. In this diagram, you can see that there is a splitting. This is your layer, this is one layer, and this is the another layer. Now this layer is the meningeal layer of dura mater, and this layer is your periosteum or endosteal layer of dura mater. In between, you can see that the sinus is present. So the meningeal layer form, which part is formed by the meningeal layer? So this meningeal layer is forming the roof and it is forming the lateral wall. Clear? So the meningeal layer form the medial wall, but where medial wall? Only this much small portion of the medial wall. Clear? Then it is forming the roof. So this is the roof and it is forming the lateral wall. So this is the lateral wall. So these are the three contributions of your meningeal layer. That is the lateral wall, roof, and a small portion of the medial wall. Then you will see the floor. The floor of the sinus is formed by this layer. This is the nothing but it is the periosteum of your sphenoid bone. So when you will see the wall of your this cavernous sinus, there are four walls which you have to understand: roof, lateral wall, floor, and medial wall. Clear? The meningeal layer is forming the medial wall, the roof, and the lateral wall, while this floor is nothing but periosteum of the body of sphenoid bone. Then what are the relation? Now this is something very commonly asked question in your exam. Write down the relations of cavernous sinus. Now you will learn the relation in two ways: outside the cavernous sinus and inside the wall of cavernous sinus. Now first we will discuss outside the cavernous sinus. So outside the cavernous sinus, what are the superior relation? Superior relation means that this is the roof. Now name the structure which lies on top of this sinus. That is the relation above the roof. Now on the top of this sinus, you are able to see the section. Now what is this section is? This section is nothing but it is the point where you have the crossing of your optic nerve fibers, and that is known as optic chiasma. So optic chiasma, and there is a beginning of optic tract. So when you will see the optic nerve will show the crossing, and this is the nerve, then you will have chiasma, and then you will have the tract. So this part is present in the relation to the roof of your cavernous sinus, plus there is a presence of olfactory tract, and we also have the last, or I should say terminal part of internal carotid artery. Now this is something important. When we will see this artery in the coming slide, you will realize that this artery is having the S-shaped course that is known as carotid siphon. So when you will see the carotid siphon, its terminal part will ultimately come out here in the roof area, in this roof area. So this is the internal carotid artery which you can see right now in this sinus, and this artery will make it turn and come out here. So that will ultimately reaches to the roof. That's why it is written that after emerges from the roof. Clear? So there is a confusion between the relation of internal carotid artery. Sir, it is a central structure or it comes in relation to the superior part? The answer is that the part which is in the center is the cavernous part, and its terminal end which comes here is after the piercing the roof of your cavernous sinus. Then you have the anterior perforating substances which is actually present on the inferior surface of the brain. Clear? So in nutshell, the most important relation is optic chiasma and beginning of optic tract. Clear? The next is medial relation. Now what do you mean by medial relation? Now this is the midline and this is your medial wall. So anything which is medially present is known as medial relation. So here this is the pituitary gland, below body of sphenoid, and what you will have in the body of sphenoid? The air space, that is the sinus. Clear? So what are the medial relation? Medial relation is pituitary fossa, which is having the pituitary gland, body of sphenoid, and in the body you will have air sinus. But apart from that, you have one more fold of this dura mater. If you remember the class of dural fold, we learn one more fold around the pituitary fossa in the sella turcica, and that is known as diaphragma sella. So what is diaphragma sella? It is nothing but it is a infolding of the meningeal dura mater. So this is the meningeal dura mater. So the roof of the cavernous sinus continue as a fold is known as diaphragma sella. Clear? Then what are the lateral relation? Now see, you have to understand this part that when we are seeing the cranial cavity, in the middle we are talking about the body of sphenoid bone. In this you have the anterior cranial fossa, you have the middle cranial fossa, you have the posterior cranial fossa. Now you have this cavernous sinus on both the side of sphenoid bone. Clear? Now what will present here? In the middle cranial fossa, what structure lies here? Now these structures become lateral relation to your cavernous sinus. So in this part, majorly you have temporal lobe of cerebrum. So this is the important thing which you have to understand, that temporal lobe is in the lateral relation to the cavernous sinus. But apart from that, there is one more important structure, and that is known as Meckel's cave. Now this Meckel's cave, if you remember the class of my dural sinus, I told you that you have the Meckel's cave which is present here near the apical part of the petrous temporal bone. Now this cave remains separated by the lateral wall. So lateral wall is present like this, and this lateral wall is separating the cave from the cavernous sinus. Then you have the lateral wall extension from superior orbital fissure to the apex of petrous bone. So when we will see in the diagram, what you are able to appreciate, that this is your trigeminal nerve. Now this trigeminal nerve is having the ganglia here. This ganglia is known as trigeminal ganglia, and this ganglia is receiving the three branches, ophthalmic, maxillary and mandibular. Now this ganglia remains separated by this lateral wall from the cavernous sinus, which is present here. Clear? So this is the question of your exam, that is the trigeminal cave or Meckel's cave is a part of cavernous sinus, or it is related with which wall of cavernous sinus? So it is related with the lateral wall, but in the posterior part of the lateral wall you have Meckel's cave or cave for trigeminal ganglia. Now what are the contents of this cavernous sinus? So there are two important contents. One is the artery and another is the nerve. Now the artery is known as internal carotid artery, and there are some nerves, and these nerves passing forward through the cavernous sinus to enter the orbit via superior orbital fissure. Now when you will see the orbit, now see, when we will talking about the orbit, we are talking about the cranial nerves. Those are concerned with the eyeball. So what these cranial nerves are? Third, that is oculomotor. Fourth, that is trochlear, and sixth, that is our abducent. So these are the important cranial nerves, plus you have ophthalmic division of trigeminal, that is the first branch of your fifth cranial nerve. So these cranial nerves which are related with the orbit passing through the cavernous sinus to enter into the orbit, and that space is known as superior orbital fissure. So the contents of the cavernous sinus include the structure lying within the cavity and those outside the cavity, that is in the lateral wall. Clear? So when you will see the contents, you will see the content at two places, in the center and in the lateral wall. And what these contents are? These contents are basically one artery, that is internal carotid, and nerves. Now what these nerves are? The nerves, those are entering into the orbit through the superior orbital fissure. So what are the structures in the lateral wall? So this is the first question. Name the relations from above downward in lateral wall. So third cranial nerve, fourth cranial nerve, branch, first branch of the fifth cranial nerve, and the second branch of fifth cranial nerve. So what is the sequence? Oculomotor, trochlear, ophthalmic, and maxillary nerve. The cranial nerve, they run forward into the lateral wall between the dura and endothelial lining. This is the important thing which you can appreciate in this diagram, that this is the lateral wall and this is the endothelial lining. And between them you are having the structure from above downward. This is your third, fourth, first branch of trigeminal and second branch of trigeminal. Now where they are going? Now these three are going into the orbit, while this maxillary nerve will enter into the foramen rotundum. Now what are the relation in the cavity? In the cavity you will have the two structure, internal carotid artery and sixth cranial nerve, that is abducens nerve. Now when we see the internal carotid artery, this internal carotid artery is divided into the multiple parts, but when we are talking inside the cranial cavity, in relation to the cavernous sinus, the part is known as cavernous part of internal carotid artery. Now this cavernous part is present in the cavernous sinus on the side of your body of the sphenoid, and the internal carotid artery, it enters through the carotid canal of your base, then it ascends, After ascend, it turn forward. It turn forward or it turn anteriorly, and it come on the side of your body of sphenoid within the cavernous sinus, and ultimately it curves anteriorly and reach to the superior aspect where it comes in relation to the roof of your cavernous sinus. Now first we will see this diagram. Now here you can see that this is your carotid canal. Now this is your internal carotid artery. Now once you will see it enters into the cranial cavity, then it turns anteriorly. You can see that it is turning anteriorly. After passing through the cavernous sinus, it is again turning and it is coming out superior to the cavernous sinus. Clear? So you can see here that this is the loop and this is known as carotid siphon. What is that? It is carotid siphon. And the important relation here about the internal carotid artery, that this part which is superiorly placed here is now comes in relation to the roof of cavernous sinus. So this is the cavernous sinus. Now this artery is now present at roof of cavernous sinus at the terminal point. So dear students, whenever you are reading about the internal carotid artery, the first point is that which part of internal carotid artery present in relation to the cavernous sinus? Answer is cavernous part. And what is the arrangement of internal carotid artery here? That once it ascend, it take anterior turn, and after taking anterior turn, it passes through the cavernous sinus, which you can see the blue color network of the veins. Then at the anterior end, it turns, pierces your roof and lies in the upper relation of the cavernous sinus. Then you will have the abducens nerve. Abducens nerve, you know that it is going to enter into the orbit through the superior orbital fissure, and this nerve passes through a dural canal to reach the sinus, and this canal is known as Dorlow's canal. Now this is the question of your exam. So many times you have this one line question. So when you will see the abducens nerve, it is passing within a dural canal that is known as Dorlow's canal. Then it runs in infero-lateral relation. Now this is again the question of your exam, infero-lateral relation. Now here you can see that these are the two structure about which we are talking. Upper one is your internal carotid artery and this lower one is abducens nerve. Now this abducens nerve is inferiorly to the artery and little bit lateral to the artery. Clear? So it is inferior lateral of to the horizontal part of the artery and just medial to the ophthalmic division. So this is your ophthalmic division. So ophthalmic division के बिल्कुल medially क्या structure होता है? Answer is abducent nerve. So when you will see this diagram, what you are able to appreciate that there are three things which you have to identify. First is the internal carotid artery. Second, you have to look for this abducent nerve, and just lateral to the abducent nerve you have ophthalmic division of your trigeminal nerve. Clear? So in the center of or in the cavity what you are able to see, two structure, cavernous part of internal carotid artery and abducent nerve. Then we will reach to the veins of cavernous sinus. Now what do you mean by the veins of cavernous sinus? That means we will see there are two types of the vein. One is the vein, those are taking blood into the cavernous sinus. The veins which are taking blood are known as tributaries. They are known as tributaries. And the second set of the vein, those are taking blood away from the cavernous sinus. That means they are responsible for emptying the sinus and they are known as draining channel. They are known as draining channel. So tributaries will fill the sinus. Tributaries are incoming. So they will fill the sinus. And draining channels are outgoing. So with the help of them, the sinus will empty. So although the venous blood is entering the cavernous sinus at the front and the blood leaving the sinus from the behind. So generally blood will enter from the anterior aspect of the sinus and generally the blood will drain from the posterior aspect of the sinus. But the blood can flow in either direction in the sinus depending upon the local venous pressure because there are no valve in the cavernous sinus as well as its draining channel or tributaries. This is the question of your exam which you have to keep in mind, that in case of the change in pressure gradient, the flow direction of blood can also change because there is no valve in the tributaries or draining channels of cavernous sinus. So what are the tributaries? So these are the tributaries, those are filling channels or those are incoming channels to the your cavernous sinus. So the blood is coming from the three sources. First is orbit, second is the bone of the vault, and third is the cerebral hemisphere, that means the brain. So there are three sources from where the blood is coming into the cavernous sinus. So there are first three veins. These three veins are superior inferior ophthalmic vein and central vein of retina. These are carrying the blood from orbit. These are carrying blood from orbit to the cavernous sinus. Then you will have middle cerebral vein and sometimes the inferior cerebral vein. They are carrying blood from the brain, that means cerebrum, from cerebrum. Plus you have the veins, those are draining your bone plus meninges. They are draining bone plus meninges. Clear? So whenever you are reading the source of the blood into the cavernous sinus, you are having the three sources from orbit, superior inferior ophthalmic vein and central vein of retina. From the brain, that is your superficial middle cerebral vein and sometimes inferior cerebral vein. Then from the bone and meninges, we have sphenoparietal sinus and middle meningeal vein. Now we will discuss one by one, a brief about these tributaries. So first is superior ophthalmic vein. Now when you will see the diagram of this side of the face, what you are able to appreciate that this is the superior ophthalmic vein. Now this superior ophthalmic vein is draining into the cavernous sinus, but the most important thing which you have to understand, that the connection between the orbit and the middle cranial fossa is known as superior orbital fissure. What is that? Superior orbital fissure. It is not inferior orbital fissure. देखिए यहाँ पे बात आप बिल्कुल अच्छे से समझ लें कि superior orbital fissure ही cranial cavity में खुलता है. Inferior orbital fissure cranial cavity के अंदर open नहीं होता. Inferior orbital fissure open होता है infratemporal fossa में. Clear? So you have to understand this thing, that superior orbital fissure allow this vein to enter inside and inferior orbital fissure is actually open into this area which is known as infratemporal area. Clear? Now this superior or ophthalmic vein commences above the medial palpebral ligament, and it goes back to drain into anterior part of the cavernous sinus. So here you can see that this is the superior ophthalmic vein. It forms at the medial side of your eye, and then it is going posteriorly above the optic nerve. It enters through the superior orbital fissure, entering into the middle cranial fossa, and ultimately draining here. That is this area is known as cavernous sinus. It communicates at the commencement with angular vein. So जहाँ पे इसकी शुरुआत हुई, when this is the formation, it is also having the angular vein. Clear? Then you have the inferior ophthalmic vein. Now inferior ophthalmic vein commences at the front of orbital floor. So where is the formation? Near the floor of your orbit. Now see, I told you there are two things. One is superior orbital fissure, another is inferior orbital fissure. If the inferior ophthalmic vein is directly entering into the middle cranial fossa, then it is always passing through the superior orbital fissure. But if the inferior ophthalmic vein is, rather than entering into the cranial cavity, if it will come out into the infratemporal fossa, then it will take the inferior orbital fissure to come out. Are you getting this point? That there are two fissures, superior orbital fissure and inferior orbital fissure. Now here what I mean to say is that if this inferior ophthalmic vein is directly draining into the cavernous sinus, then what is the name of the passage? Answer is superior orbital fissure. But if this vein is coming out into the infratemporal fossa, then you are having one more gap here, and that is known as inferior orbital fissure. Clear? So it is having the two way of drainage. One is known as direct drainage into the cavernous sinus, that is through the superior orbital fissure. One is known as indirect way of your drainage, that is through the inferior orbital fissure, and through the inferior orbital fissure it will communicate with the venous plexus, and that is known as pterygoid venous plexus. Clear? Now in this diagram you can appreciate again the both thing which I am saying. Now this is your area of superior orbital fissure. Now here you have the cavernous sinus. Now in this cavernous sinus, this is the superior ophthalmic vein which is draining here. So this is the superior ophthalmic vein. Now this is the inferior ophthalmic vein. Now this inferior ophthalmic vein is having two ways of your drainage. One is either it will go to the superior orbital fissure, merge with the superior ophthalmic vein and drains into the cavernous sinus. The second way is that it may enter into the pterygopalatine fossa through this inferior orbital fissure, and here it will join a venous plexus that is known as pterygoid plexus of vein. Clear? And then later on we will see that pterygoid venous plexus will give the emissary vein through which you have the communication with cavernous sinus. Clear? Then you have one more tributary, superficial middle cerebral vein. Now if you will see this diagram, this is the superficial middle cerebral vein. Now superficial middle cerebral vein is also having a communication with the superior sagittal sinus with the anastomotic vein. But when you will see the inferior surface of the brain, you will appreciate that this middle superficial cerebral vein is ultimately draining into the cavernous sinus. Clear? So this is middle superior superficial cerebral vein. This superficial middle cerebral vein is also having communication with the superior sagittal sinus, and it is directly draining into the cavernous sinus. Clear? Then you have the sphenoparietal sinus. Now this sphenoparietal sinus present along the posterior margin of lesser wing of sphenoid. So this is the area where you have this sphenoparietal sinus, and this sphenoparietal sinus ultimately opens into this anterior part of your cavernous sinus. Then we have the draining channels. Draining channels means the channels, those are responsible for emptying of the cavernous sinus. Here you have the two names importantly, superior petrosal sinus, inferior petrosal sinus. Now the first and important thing is that superior petrosal sinus is a small sinus, while the inferior petrosal sinus is a larger sinus. So this is the first and most important question, that majority drainage is done by the inferior petrosal sinus. Now this superior petrosal sinus, if you remember, we have seen the attached margin of tentorium cerebelli along this part of the petrous temporal bone. So here you can see that this is the cavernous sinus. From the posterior end of the cavernous sinus, you have the beginning of superior petrosal sinus. Now this superior petrosal sinus is going backward and it will join this sinus. This is the transverse sinus. Now you know that transverse sinus continue as a sigmoid sinus till this canal is known as jugular fossa. Now at the junction of transverse sinus and sigmoid sinus, we are having the opening of this superior petrosal sinus. So at this point you are having the three sinus. One is the transverse sinus, second is it will continue as a sigmoid sinus, and third thing, at this point it is receiving the superior petrosal sinus. So it runs back along the upper border of the petrous bone, along the attached margin of the tentorium cerebelli, and it enters the point of the termination of transverse sinus at the commencement of sigmoid sinus. Clear? Then you will have inferior petrosal sinus. Inferior petrosal sinus is a larger sinus and it empties the bulk of the blood. Majority amount of the blood from the cavernous sinus drain into the internal jugular vein. So this is the question of your exam, that where is the opening of inferior petrosal sinus. Second thing is that this begins postero-inferior aspect of the cavernous sinus and it runs into a fissure that is known as petroclival fissure. Now this petroclival fissure is a groove between the petrous part of temporal bone and basilar occipital bone. Now where you will find, now this is the posterior cranial fossa. Now when you will see the posterior cranial fossa, this is the bony framework where you can see that this portion is known as clivus. This is known as clivus. And this is the petrous part of your temporal bone. Which bone is this? This is the petrous part of the temporal bone. Now in between them you have this groove, and this groove is known as petroclival groove. That is the groove between the petrous part and the clivus. That's why this is the inferior petrosal sinus, and this inferior petrosal sinus is running into this area. It is running into this area, and this is your canal for your jugular fossa. So ultimately this will reach up to this jugular canal from where the internal jugular vein starts. So where is the superior petrosal sinus? Here, along the upper margin of petrous part of temporal bone. Where is the inferior petrosal sinus? Here, along the inferior margin of your petrous bone. But here this area is known as petroclival fissure. Clivus means this slope part of your occipital bone. Clear? Then you have the communication. The first communication is intercavernous sinus. Now you have seen that both sides of the cavernous sinuses are connected by anterior and posterior intercavernous sinuses. Second thing is that there is a connection with emissary vein. If you remember the class of the dangerous area of face, we have seen that there are few veins, and these veins are entering into the cranial cavity through the three foramens. One is known as foramen ovale, another is foramen lacerum, and third is foramen vitellius, which may be present, may not be present. And when these pterygoid venous plexus drains into this cavernous sinus, it is a source of infection that we have discussed in the dangerous area of face. Now in this diagram you can see that there are three imagery veins which are present here. They are entering inside to reach the cavernous sinus, and this is the pterygoid venous plexus. And this pterygoid venous plexus is receiving the inferior ophthalmic vein through the inferior orbital fissure. Now this is what is the summarized view of your cavernous sinus. Now this is your cavernous sinus, and here you can see that this is the transverse sinus, and this transverse sinus is continue with the sigmoid sinus. So this is the sigmoid sinus. At this junction you are receiving this connection, and this connection is known as your superior petrosal sinus, while this is the inferior petrosal sinus, and this inferior petrosal sinus enters at the commencement of your internal jugular vein that runs downward, which is a major draining channel of cavernous sinus. Now what are the clinical anatomy? So there are three types of the clinical anatomy related to the cavernous sinus. One is the thrombosis, second is the tumor, and third is the carotico-cavernous sinus fistula, and it is also known as pulsatile proptosis or pulsatile exophthalmos. Now in all these three you have the common features. Why? Because ultimately there is a affection of third cranial nerve, fourth cranial nerve, ophthalmic cranial nerve, abducent cranial nerve. So the features are related to the pain in the distribution areas of these cranial nerve. There are diplopia occurs because of the loss in coordination of extraocular muscle. There is a venous symptoms because of the congestion of the superior and inferior ophthalmic vein. So patient will having the papilloedema, patient is having difficulty in the vision, swelling, periorbital edema. Now what is the thrombosis of cavernous sinus? Now thrombosis of cavernous sinus caused ophthalmoplasia from ocular nerve interruption. Okay, that I told you. At the medial angle of the eyelid, there is a communication between the angular vein and the ophthalmic vein which drains directly into the cavernous sinus. That I just told you that superior ophthalmic vein directly drain into this sinus through the superior orbital fissure. Blood from the forehead normally flow via the facial vein. Generally you will have whatever the blood is here, it is draining through the facial vein downward. Clear? But if the facial vein is blocked by the thrombosis, the blood above the obstruction will flow through the orbit into the cavernous sinus. So suppose if the block is formed here in the facial vein, then what will happen that this blood is now start to enter through the cavernous sinus into the cavernous sinus through the superior ophthalmic vein. Now there is also one more communication that is known as deep facial vein. Now this deep facial vein is not having the direct connection. Deep facial vein will go to the pterygoid venous plexus. This deep facial vein will go to the pterygoid venous plexus. So you have to understand that cavernous sinus is having two connections from the face. The first connection is with the help of ophthalmic vein. Second connection is indirect connection from the deep vein to the pterygoid venous plexus, and from pterygoid venous plexus you have the imagery vein that will open into your cavernous sinus. So cavernous sinus is having two type of communication with the face, direct through the ophthalmic vein and indirect from the deep facial vein to the pterygoid venous plexus to the imagery vein, and ultimately you will reach to this cavernous sinus from these different foramens. So this is the dangerous area of the face which is present between the tributary, between the area of your superior ophthalmic vein and deep facial vein. Then you have the tumors. Now tumors may be inside the cavernous sinus or from outside the cavernous sinus. If they are inside, it can be meningioma, it can be hemangioma, it can be schwannoma. Or if it is outside, then they are typically arises from pituitary gland. Apart from that, you have carotico-cavernous sinus fistula. Now what does it mean? You have seen that there is a presence of your artery. There is a presence of internal carotid artery. Now this internal carotid artery, if get rupture, then what will happen? The arterial blood will come out into the cavernous sinus. So direct communication between the intracavernous portion of internal carotid artery. So this is the intracavernous portion of the artery, and if this will get rupture, if we will create a fistula, if there is a puncture, then it may occur as a result of severe head injury or to the trauma, or there is an aneurysm. The classical sign are ptosis, proptosis, chemosis, extraocular symptoms which are secondary to a combination of the third, fourth and sixth cranial nerve palsies are seen. Now dear student, here one important thing which is written here is pulsatile. Now what does it mean? That because the artery is now ruptured, so the blood is coming out into the cavernous sinus, and we know that cavernous sinus is having anterior communication with the orbit. So what will happen, that with the each pulse, with the each systolic pulse, there is a pulsation seen on the orbit, and this is known as pulsating exophthalmos or pulsating proptosis, which is a characteristic feature. So when you are talking about carotico-cavernous sinus fistula, it is actually the leakage of the blood from your cavernous part of internal carotid artery into the cavernous sinus, and furthermore the cavernous sinus is having communication with the orbit, and that will lead to the pulsating exophthalmos. So at the end of this class of cavernous sinus, we are able to understand the boundaries of cavernous sinus, relations of cavernous sinus which are most important relation, and the three basic applied anatomy of cavernous sinus. So this is all for today's class. Thank you.